Hey everyone, and welcome back to EnglightenPro. I'm Emily.
And I'm Jack. We're so excited to have you with us today.
This episode is something a little different and really special. If you've ever wanted to work with the UN, NGOs, or in any humanitarian organization,
Or you're already in the field and want to level up your English, you're in the right place.
today we're focusing on advanced English listening practice for humanitarian work, using real-world language inspired by the SPHERE standards and global emergency response.
Humanitarian charter and minimum standards in humanitarian response.
That's right. And it really is, well, essential is the word. The SPHERE Handbook, it's probably one of the most widely referenced guides out there globally. It basically gives you a framework for quality, for accountability, and humanitarian action. And it's all based on this core belief that, people affected by disaster or conflict, they have the right to life with dignity and the right to get assistance that respects that.
Exactly. And understanding that framework, the language, the key ideas, that's just crucial if you want to be effective. Right. So that's what we're trying to do for you today. We've gone through the SPHERE Handbook source material, pulled out some of the, let's say, most important terms and ideas. We'll define them, talk about why they matter, give you some examples of how you'd actually hear them used, and maybe offer some tips for using them in your own professional English.
Yeah, think of this as like your guide to mastering the language of humanitarian standards, getting comfortable with that specific vocabulary.
All right, let's dive in. Where else to start but with the big picture? The SPHERE Handbook itself, what actually is it?
Okay, so at its heart, the SPHERE Handbook is a voluntary code. It's not law, but it's this widely accepted thing. It brings together key pieces: the humanitarian charter, the protection principles, the core humanitarian standard, and then those minimum standards for different sectors.
So it's not like a step-by-step instruction manual, more like a description of what needs to be achieved.
Exactly. It describes what minimum standards have to be met so people can survive and recover from a crisis with dignity. It provides the sort of ethical and legal background for action.
And why is it so important to have this globally recognized document?
Well, its importance really lies in setting those common, recognized standards for humanitarian response everywhere. It gives everyone, different agencies, different countries, a shared language and a shared benchmark for quality and accountability. That's huge in complex crises.
Okay, so in practice, you might hear someone say, our response plan is guided by the SPHERE Handbook, or maybe, could you please consult the SPHERE Handbook for the minimum requirements here?
Absolutely. That's exactly how it's used. And, a practical tip for advanced learners, when you're talking about best practices, citing the SPHERE Handbook adds real weight. You could say something like, as per the SPHERE Handbook standards. It just shows, the framework.
Makes sense. Okay, moving on to one of those core pieces you mentioned, the Humanitarian Charter. What's that about?
The charter is, well, it's the foundation. It expresses this shared belief, this conviction among humanitarian groups, that all people hit by crisis have a right to get protection and assistance. And it ensures the basic conditions for life with dignity. It's the ethical and legal bedrock, really.
So it really grounds everything in rights and dignity.
Precisely. It affirms the rights of affected people and also, implicitly, the duties of those providing help. It actually builds on earlier codes, like the Red Cross Code of Conduct from '94.
Okay, so you might hear it referenced like, the Humanitarian Charter reminds us of our fundamental obligation. Or maybe, our agency's mandate is aligned with the principles of the Humanitarian Charter.
Yes, exactly. And professionally, if you're advocating for something, understanding how the charter links to established legal rights, like the right to life with dignity, that strengthens your argument.
Got it. So from the charter, we get to the minimum standards. You hear this term all the time. What are they specifically?
The minimum standards, they describe the minimum level of assistance needed in humanitarian response. They cover key areas: water, sanitation, food, nutrition, shelter, health. And they're all about making sure people's right to life with dignity is actually met in practice.
And these are designed to be like actually achievable,
Yeah.
even in tough situations.
Yeah, that's the idea. They're meant to be attainable benchmarks in most emergencies. They focus on what needs to be achieved, like, say, a certain amount of water per person, not how you do it. That leaves room for adapting to the local context. Their importance is providing those concrete benchmarks for quality.
Right. So in the field, someone might say, we need to ensure our water supply meets the sphere minimum standards, or maybe the emergency shelter provided meets the minimum standards for living space.
Perfect examples, and a useful tip here. Always try to pair minimum standards with the sector. So wash minimum standards, shelter minimum standards. It just makes things clearer in reports or discussions.
Good tip. Now, something that seems to cut across everything, protection. Let's define the protection principles.
Okay, the protection principles. These are absolutely fundamental to all humanitarian action. They basically inform every part of the response. They emphasize ensuring people's safety, their dignity, and making sure their rights are respected and upheld.
Yeah, I remember the source mentioning things like ensuring safety and dignity, ensuring access to impartial aid, helping people claim their rights, and the crucial point about not causing harm yourself.
Exactly. That do no harm principle is central. The importance here is guiding aid workers to not just provide stuff, but to actively work to protect people from violence, from coercion, from deprivation, and crucially, to avoid causing harm through the response itself.
So you'd hear things like, our program design was reviewed against the protection principles, or maybe training staff on protection principles is mandatory.
Absolutely. And in meetings, you can frame recommendations around them, like, to uphold the protection principles, we should really ensure. It adds a layer of justification.
Okay. Now, also related to overarching standards, there's the core humanitarian standard, or CHS. How does that fit in?
Ah, the CHS, right. The CHS on quality and accountability, it contains 9 specific commitments that humanitarian organizations make to the people they aim to assist. It outlines what affected communities can basically expect from aid groups.
And what sort of commitments are we talking about?
Things like ensuring assistance is appropriate and relevant, making sure people participate, having complaints mechanisms that actually work, using resources well, that kind of thing.
So it's important because it provides a common standard for accountability and quality management across the sector. And it links back to the Charter's rights.
Precisely. It gives a clear framework for how organizations should operate accountably. So, examples of use. We are implementing the CHS commitments to improve our accountability. Or, the CHS requires us to establish a proper complaints mechanism.
And for professional use, referring to the CHS gives you that recognized framework again. You can say, our policy aligns with CHS Commitment X on participation, for instance.
Perfect. And that brings us nicely to accountability itself, a key part of the CHS and sphere overall.
Right. Accountability. What does that actually mean in this humanitarian context?
Well, accountability here means being responsible for your actions and decisions, but particularly to the people you're trying to help. It's about using resources efficiently, sure, but also showing that your actions are actually leading to positive outcomes for them.
So it's not just about ticking boxes for donors, it's primarily towards the affected community.
Exactly. The source really links it to things like monitoring, evaluation, having feedback mechanisms. Its importance honestly can't be overstated. It builds trust, it ensures your work is effective, and it helps prevent aid being misused. It's supported right across the board by the CHS.
So you'd hear sentences like, we are committed to strengthening our accountability to affected communities, or robust monitoring is absolutely essential for accountability in this project.
Yes, a practical tip. Use accountability when you're discussing feedback loops, reporting mechanisms, or responsible resource management. For example, this system improves accountability to beneficiaries. It specifies who you're accountable to.
Okay. And another crucial element, also in the CHS and throughout the handbook, participation.
Participation. This means making sure that affected people are actively involved in the decisions that affect their lives and the aid they receive. It's about them having a say.
The source mentioned consulting with communities on, like program design, implementation, monitoring.
Right. And its importance lies in ensuring the response is actually appropriate, relevant, and respects people's dignity in their own capacity. It moves beyond seeing them just as, recipients of aid. It recognizes they have agency.
So examples like, meaningful participation of women and girls is key to this WASH project, or maybe we need to consult with the community to ensure participation in the assessment process.
Exactly. And when you're planning things, try to use phrases like ensuring participation, consulting with affected people, or talking about two-way communication. It shows you're taking it seriously.
Makes sense. Now, before you can even provide aid effectively, you need to know what's actually needed. Which brings us to needs assessment.
Needs assessment, yes. This is the process, the formal process of gathering and analyzing information. Information about the situation, the needs, yes, but also the capacities and vulnerabilities of the population affected by the crisis.
And the source mentioned looking at changes from before the crisis, identifying immediate needs and capacities for both displaced people and those who haven't moved. Joint assessments, too, to avoid duplication.
Precisely. It's absolutely fundamental. It's the basis for designing a response that's actually relevant and appropriate. A poor assessment that can lead to ineffective, even harmful interventions.
So very common usage would be, we are deploying a team to conduct a rapid needs assessment, or the program design is based entirely on the findings of the initial needs assessment.
Absolutely. And in reports or proposals, citing the needs assessment findings is non-negotiable, really. Use phrases like, based on the needs assessment result.
Okay, digging a bit deeper into those assessments. Data disaggregation, what's that?
Data disaggregation. It simply means breaking down the data you collect by specific categories. Things like sex, age, disability, where people live geographically, ethnicity, religion, whatever factors are relevant in that particular context.
And the point is to understand the different needs and impacts on various groups within the population, not just looking at averages.
Exactly. Its importance is huge because it helps you identify who might be most at risk. It ensures that your assistance is impartial and actually reaches those who need it most. It helps avoid discrimination and overlooking vulnerable individuals who might get lost in the averages.
Right, so you'll see this in reporting requirements. Assessment data must be disaggregated by sex and age, or maybe explaining a finding like, disaggregated data highlighted the specific challenges faced by persons with disabilities in accessing water points.
Definitely. And when you're presenting findings, always mention if the data is disaggregated and what that showed. It signals rigor and that you're paying attention to vulnerable groups.
Which connects directly to the idea of identifying at-risk groups or vulnerable groups.
Yes, these terms refer to specific individuals or groups within the affected population who face increased risks or have specific needs. This could be due to factors like age, sex, disability, health status, sexual orientation, their displacement status, maybe ethnicity or religion.
The source gives examples like children, women, older people, persons with disabilities, LGBTQI+ people, people with chronic illnesses.
Right, and identifying and understanding these groups is critical for applying those protection principles we talked about earlier, and for ensuring that assistance is impartial and truly needs-based, as the handbook emphasizes across all sectors.
So, usage examples. We need to implement specific measures to protect at-risk groups.
Ooh.
Or the assessment paid particular attention to the needs of vulnerable populations.
Yes, and a good practice tip. Try to be specific when you can. Instead of just saying vulnerable groups, maybe say, addressing the needs of older people and persons with disabilities. It's more precise.
Good point. Let's revisit protection again, but this time as a cross-cutting theme. It's not just a set of principles, right? It applies everywhere.
Absolutely. That's exactly what cross-cutting means here. It means integrating protection considerations into everything: WASH, food security, shelter, health, logistics, everything. The goal is to ensure that our interventions don't accidentally put people at risk, and ideally, that they actively contribute to people's safety and well-being.
Yeah, the source mentioned things like assessing safety risks when planning settlements, or even how you manage information can be a protection issue.
Exactly. Its importance is embedding that do no harm principle and proactive protection efforts right into the core of how humanitarian programs are designed and run.
So you might say, we need to ensure protection is mainstreamed across all our sector activities. Or this water point design incorporates protection measures for women and girls.
Yes. And when you're discussing program design, always ask, how does this contribute to protection? Or Are there any potential protection risks here we need to mitigate? It should be a constant question.
Okay, great. Let's dive into some of the specific sector standards now, starting with wash water, sanitation, and hygiene. And first up, water supply standards.
Right. The water supply standards define the minimum requirements for both the quantity and the quality of water that people affected by crisis need access to.
The source specifies minimum amounts, like liters per person per day, and quality indicators, like checking turbidity or chlorine levels.
Yes, and meeting these standards is vital for preventing waterborne diseases. They're a huge killer in emergencies. It's about ensuring safe water right from the source to the point where people actually use it.
So, sample sentences. The goal is to provide X liters of water per person per day, meeting the Sphere water supply standards, or regular water quality testing ensures we meet the minimum standards.
Exactly. And in the field, you'd focus on those specific metrics, reporting findings against indicators like percentage of water quality tests meeting minimum standards.
Okay. Closely linked, still in WASH, is sanitation standards, specifically around excreta management.
Yes, excreta management standards. These cover the safe containment, removal, and disposal of human waste. Basically dealing with poo safely to stop diseases spreading.
So it covers designing and building toilets, making sure they're maintained, ensuring they don't contaminate water sources.
Precisely. And their importance is critical for public health. Poor sanitation is a massive contributor to diarrheal diseases and environmental contamination.
So usage examples might be: the latrine construction must adhere to Sphere excreta management standards, or we are implementing a desludging plan according to sanitation guidelines.
Right. And when discussing facilities, using the precise terms from the handbook, like excreta management facilities or desludging, adds clarity, differentiating it from other waste.
Okay. WAFASH also includes hygiene promotion.
Yes, hygiene promotion standards focus on promoting behaviors that prevent disease transmission. Things like hand washing with soap at critical times, handling water and food safely.
And this involves figuring out what essential hygiene items people need, educating communities, but also understanding local knowledge and behaviors first.
Exactly. It's not just about telling people what to do, it's understanding their current practices and beliefs. Providing toilets and water isn't enough. People need the knowledge, the motivation, and the means like soap to adopt safe hygiene practices to get the health benefits.
So sentences using this. Our WASH program includes a strong hygiene promotion component, or hygiene promotion campaigns are needed to address key health risks we're seeing.
Yes. And when planning community outreach, use phrases like hygiene promotion activities and really emphasize understanding community knowledge and behaviors first.
Got it. An often overlooked part of WASH, maybe, is vector control.
Ah, vector control. Yes. These standards address measures to prevent diseases transmitted by insects and rodents vectors. Things like malaria from mosquitoes, dengue, or plague from fleas on rodents.
So this includes managing breeding sites, maybe using mosquito nets, and working with local vector control plans if they exist.
Exactly. It's important because these vector-borne diseases can spread incredibly rapidly in emergency settings, especially crowded ones, and cause a lot of illness and death.
Examples. The program is distributing mosquito nets as part of the vector control strategy. Or we need to assess potential vector breeding sites around the settlement.
Right. And when discussing disease prevention, remember to include vector control alongside water and sanitation efforts. And often, you need to identify high-risk groups for specific action.
And the final piece of WASH we'll look at is solid waste management.
Solid waste management. This involves the safe collection, handling, and disposal of all the other types of waste generated in a crisis: household rubbish, medical waste from clinics, potentially hazardous waste.
And the standards cover planning systems, collection points, safe disposal methods like burying or burning, trying to minimize environmental impact and health risks.
Yes. Its importance is preventing public health risks, like creating places for those disease vectors to breed, attracting pests, and avoiding environmental pollution. It also addresses safety risks for children or waste pickers.
Okay. Usage. A comprehensive solid waste management plan is needed for the camp, or we are establishing collection points for household solid waste.
Exactly. And when discussing waste, it's helpful to distinguish clearly between excreta and solid waste. Using terms like collection point or disposal facility is useful.
Right. Let's move to another critical sector, food security and nutrition.
Okay. Food security and nutrition. This whole area is about ensuring that all people have physical and economic access to sufficient, safe, and nutritious food, enough to meet their dietary needs and food preferences for an active and healthy life. Nutrition also focuses on how the body actually uses that food.
And the sphere standards here are like a practical expression of the right to adequate food in emergencies, aren't they?
Absolutely. Its importance is huge, addressing immediate hunger and malnutrition, yes, but also supporting livelihoods and longer-term recovery. It's deeply linked to protection and dignity, too.
So you'll hear. Our intervention aims to improve food security and nutrition outcomes, or the assessment analyzes the state of food security and nutrition in the affected area.
Exactly. Use this term when you're discussing the overall state of food access and nutritional status in a population.
Within this sector, nutrition assessment is key.
Yes, nutrition assessment is the process of measuring and evaluating the nutritional status of a population. This helps identify needs and design the right responses.
And this involves collecting specific data, like anthropometric data, MUAC measurements, checking for odema, maybe using standard methods like SMART or SEVENS.
Right. MUAC is mid-upper arm circumference, a simple way to screen for malnutrition. SMART and SEVENS are standardized survey methodologies. Their importance is that they provide objective data on how widespread and severe malnutrition is. This guides targeted interventions, like feeding programs. It helps understand why people are malnourished, too.
So examples. A nutrition assessment using SMART methodology is being conducted, or the nutrition assessment results show a high prevalence of acute malnutrition.
Perfect. When discussing data collection related to malnutrition, use this term and try to specify the tools or indicators used, like MUAC or SMART.
Once malnutrition is identified, the next step is management of malnutrition, covering both severe and moderate forms.
Right. This refers to the specific interventions used to treat and prevent acute malnutrition, covering both severe acute malnutrition, or SAM, and moderate acute malnutrition, MAM.
And the source mentioned different strategies targeted feeding, blanket feeding programs, inpatient or outpatient care for SAM.
Yes, and this is literally life-saving stuff. Directly addressing SAM and MAM is critical because they're major causes of death, especially for children in emergencies. It requires following strict protocols, using the right therapeutic foods, and having skilled staff.
So, usage. The clinic provides treatment for severe acute malnutrition, or we are implementing a supplementary feeding program for moderate acute malnutrition.
Yes, and use the specific term SAM or MAM when you know the severity level being addressed. Highlighting adherence to protocols is important too.
Okay, a very specialized area within nutrition is infant and young child feeding in emergencies, or IYCFE.
IYCFE, yes. This focuses specifically on protecting and supporting the nutritional needs of infants and young children from birth up to 23 months old. It covers both breastfed and non-breastfed babies in crisis situations.
And the big emphasis is on protecting and supporting breastfeeding, especially exclusive breastfeeding for the first 6 months.
Absolutely. Breastfeeding is incredibly protective in emergencies. IYCFE is critically important because proper feeding in this age group is just vital for survival, growth, development, and crises often disrupt everything. It covers appropriate complementary feeding for older babies too, and safe management if artificial feeding is needed.
So examples. The health team is providing IYCFE counseling to mothers, or we need to ensure safe and appropriate complementary foods are available for IYCFE.
Exactly. Use the acronym IYCFE when discussing nutrition for this specific age group, and emphasize the protection and support aspect, particularly for breastfeeding.
Now, food security isn't just about food distributions, it's also about people's ability to support themselves. That brings us to livelihoods.
Livelihoods, yes. This refers to the means, the activities, the assets that people use to make a living. In crises, supporting or restoring livelihoods helps people meet their own needs, including getting enough food.
The source talks about looking at pre-crisis livelihoods, doing market analysis and interventions like cash assistance or providing things like seeds or tools.
Right. Supporting livelihoods is so important for enabling self-reliance, restoring dignity, and helping people move towards longer-term recovery, beyond just immediate survival aid.
You might say, the program includes interventions to support agricultural livelihoods, or we need to conduct a market analysis to inform our livelihood support strategy.
Exactly. Use livelihoods when discussing economic activities, income generation, access to markets, or protecting people's assets. And always try to link it back to how it helps people access food and other essentials.
Okay, moving to physical protection and living conditions. Shelter and settlement.
Shelter and settlement. This sector addresses providing safe, dignified, and appropriate living spaces. It also covers the planning of settlements where people live after a crisis, whether they're displaced or staying put but needing help.
So it covers assessing needs, planning locations, providing the actual living space and maybe household items, and even issues like security of tenure, knowing you won't be evicted.
Yes, all of that. Its importance lies in providing that fundamental physical security, privacy, protection from the weather, all essential for dignity, health, and starting to recover.
Usage examples. The team is working on the shelter and settlement response plan, or we need to assess the damaged housing for shelter and settlement needs.
Right. Use this term to refer to the overall efforts related to housing and where people are living after a crisis.
And a specific standard within shelter is living space.
Living space. This refers to the minimum adequate enclosed area required per person. Enough space to carry out daily activities with dignity, safety, and privacy.
The source provides a minimum guideline, doesn't it? Like 3.5 square meters per person.
Yes, that's the key indicator. A minimum covered living space of 3.5 square meters per person. Ensuring adequate living space is crucial for health-preventing disease spread in overcrowded conditions and also for protection, reducing risks of violence or exploitation, and just for basic well-being and privacy.
So examples. The temporary shelters provide at least 3.5 square meters of living space per person, meeting the minimum standard, or overcrowding in the collective center is reducing the available living space per person.
Exactly. Use living space, often with the specific measurement from the standards, and highlight the link to health and protection risks if it's inadequate.
Implementing shelter solutions, especially repairs or rebuilding, often needs specific expertise. That's where technical assistance comes in.
Technical assistance, yeah. In the shelter sector, this involves providing expert advice, support, and sometimes training on things like safe construction methods, choosing appropriate materials, understanding building codes, assessing damage properly, or planning site layouts.
And this isn't just about bringing in outside engineers. It can also be about building local capacity, right?
Absolutely. It's important for ensuring shelters are safe, structurally sound, right for the context, and durable, but it's also really important for supporting affected people in their own recovery efforts, helping them build back safer.
Usage. We're providing technical assistance to households repairing their homes, or the project includes technical assistance on building safe foundations.
Exactly. When discussing support related to construction or structural issues, use technical assistance and emphasize that it includes building community skills, not just giving advice.
Okay, let's move to the health sector now.
Right, health. The health standards aim to reduce excess morbidity, that's illness and mortality death, in crisis-affected populations. It's about ensuring access to quality health care and essential public health measures.
So it's a broad area, covering primary health care, essential medicines, disease control, mental health support.
Yes, exactly. Providing timely and effective health care is just a cornerstone of humanitarian response. It addresses immediate life-threatening risks, but also supports longer-term recovery and dignity. It's crucial to understand how the crisis has impacted the existing health system.
So you'll hear things like, the health cluster is coordinating the response to the outbreak, or access to healthcare is a major challenge in this crisis setting.
Correct. Use health when discussing the broad efforts to address health needs in an emergency.
A core part of health is healthcare service delivery.
Healthcare service delivery. This refers to ensuring people actually have access to integrated, safe, effective, and patient-centered healthcare services, and at all the necessary levels from community care right up to hospitals.
The source mentions linking community health workers to facilities, ensuring quality care.
Yes. Its importance is ensuring that people can actually get the medical attention they need when and where they need it, tailored to the context and their specific health problems. Making sure referral systems work is key.
Examples. We are working to restore primary healthcare service delivery in the affected areas, or ensuring access to referral pathways is crucial for effective healthcare service delivery.
Exactly. When discussing the actual provision of medical care, use healthcare service delivery. Highlighting the different levels, community to facility, is important.
And delivering those services needs people, the healthcare workforce.
The healthcare workforce. This includes everyone providing healthcare: doctors, nurses, midwives, community health workers, pharmacists, lab techs, support staff. Standards ensure they have the right skills and there are enough of them to meet the needs.
The source talks about checking staffing levels, training people according to standards, and supporting staff, especially those working in tough conditions.
Yeah, a skilled and sufficient healthcare workforce is just fundamental to providing quality care. Their availability, their skills, their well-being, it all directly impacts how effective the health response can be. And this definitely includes supporting local staff who might be affected by the crisis themselves.
Usage. Training the local healthcare workforce is a priority. Or, we need to address the shortages in the healthier workforce.
Exactly. Use healthcare workforce when discussing staffing, training, or the capacity of health personnel, and mention the importance of supporting them.
A healthcare system also needs the actual stuff, essential medicines and medical devices.
Right. This refers to ensuring access to safe, effective, and quality-assured medicines and medical equipment, the ones needed for priority healthcare needs in an emergency.
And the standards cover things like having standardized lists, making sure supplies are available, stored correctly, and disposing of expired medicines properly.
Yes, having the right medicines and devices is crucial. Without them, even the best staff can't provide effective care. It requires good supply chain management and quality control.
Examples. We are procuring essential medicines according to the standardized list, or ensuring proper storage of medical devices is vital.
Exactly. Use this term when discussing medicines, medical equipment, or supply chain issues in health. Mentioning quality assurance and safe disposal is key.
A huge threat in emergencies is communicable diseases.
Yes. This area focuses on preventing the spread of infectious diseases and managing outbreaks if they happen. It involves surveillance, early detection, vaccination, and having the right treatment protocols ready.
The source details things like surveillance systems, EUR, the early warning system having thresholds for investigating outbreaks, vaccination campaigns, specific treatments.
Right. EUR is critical for catching outbreaks early. Rapid prevention and management of communicable diseases is a top priority because things like cholera or measles can just explode in emergency settings and cause devastatingly high mortality rates. It needs close coordination with WASH teams, too.
Usage. The EUR system is used for early detection of communicable diseases, or a mass measles vaccination campaign is part of the outbreak prevention strategy.
Exactly. When discussing outbreaks, surveillance, or public health measures like vaccination, use communicable diseases prevention and management. Highlight the importance of rapid response and coordination.
Okay, finally, let's touch on a critical, though sometimes less immediately visible area: mental health and psychosocial support, or MHPSS.
MHPSS, yes. This addresses the mental and emotional well-being of affected populations. It's a whole range of support, from basic psychosocial activities and psychological first aid right up to clinical mental health care for severe conditions.
The source mentions psychological first aid, clinical care for things like depression or epilepsy, supporting people with severe mental health conditions.
Exactly. Crises have profound psychological impacts: trauma, stress, loss. MHPSS is so important for helping people cope, for building their resilience and supporting their ability to recover and function. It's about providing different levels of support.
Examples. The program offers community-based mental health and psychosocial support, or training staff in psychological first aid as part of our MHPSS activities.
Yes. Use the acronym MHPSS and emphasize that support exists at different levels. It's not just clinical care. Basic human support, like psychological first aid, is crucial for everyone.
Wow. Okay, that really was a deep dive into some truly fundamental concepts from the Sphere Handbook. We've covered those core principles like accountability and protection, the minimum standards, the CHS, then looked at specific standards in Wenny Wash, food security, shelter, and health, including terms like needs assessment, livelihoods, living space, MHPSS. Quite a list.
It is quite a list. But understanding these terms and how they fit together in this Sphere Handbook, it's more than just learning vocabulary, isn't it? It's really gaining insight into the established good practices and the ethical foundations of humanitarian action.
Absolutely. And for advanced English learners aiming to work in this field, mastering this specific language is, well, it's a powerful step towards contributing effectively to this vital work.
Oh,
It gives you confidence and precision.
and, applying these standards in the real world in those complex, challenging realities of humanitarian response, that takes continuous learning, adaptation, and just a deep commitment to the dignity and rights of the people you're trying to help.
Thinking about that commitment and the challenge of actually meeting these standards, here's maybe a question to leave you with. How might adopting the language and the principles of standards like Sphere change the way you approach communication and collaboration in a humanitarian context? Could it ensure not just clarity, but maybe foster a deeper respect, a more principled approach among teams and towards the people you work with and for?
That's a really interesting thought to reflect on, how language shapes action.
Thanks for joining us for this deep dive. We really hope it equips you with key terms and maybe some added confidence for your work or studies in the humanitarian field.